Okay, so in the last couple of videos we've talked about normal lab values versus functional lab values, and how functionally with functional nutrition we're going to look at these lab values differently than how your traditional your medical doctor or your other traditional doctors would be looking at these values. Again, the normal range in lab terms is going to be a very broad range, and we're looking for optimal or functional ranges. So in evaluating these labs, the next key step is that we have to evaluate the correct labs. We have to have enough information to paint the overall picture. When you're looking at lab values, there are certain values that we'll find that are important. As a single factor, we'll find that this individual lab reading is important and all-telling. But for the most part, what we do is we take these general labs, and we will kind of paint a picture of what's going on with your health, utilizing functional lab values, utilizing questionnaires that we give you, utilizing our detailed evaluations that we do here in the office, utilizing kinesiology testing. We take all this testing and we create a picture of what's going on with your body individually, so that we can address these issues and address them in the right priority. Your body heals in certain priorities, and we'll get into that in the future as well. So which labs need to be run? You've probably had some of these done, especially if you're already experiencing symptoms that have brought you to this video series. You're probably already getting some of these labs done, but a lot of times when the labs are ordered, certain key factors are left out. So I just want to go through what I consider the general lab values that we need to have in the office, and that we can order for you when you come in and see us. Okay, so first of all, we have what's called a CBC with a differential. That's a complete blood count with a differential. Basically what that is, it's looking at what the different types of blood cells are that are in your body, how they're broken down, and it gives us information, for example, how your immune system is functioning, how whether there are some anemias that might be going on, potential inflammation issues, potential antigen issues. It gives us a whole lot of information when you're looking at these from a functional lab value. The next is what's called a complete metabolic panel. In that metabolic panel, we're looking at different organ functions. We're looking at the kidneys, we're looking at the liver. We look at, there's some findings in there that help direct us towards adrenal function. In that metabolic panel, we're also going to have your blood sugars. So we'll see what's going on with your blood sugar levels. So we can check your insulin function. Just a whole wealth of information in that metabolic panel. Next, we do the lipid panel, which is where we're looking at your cholesterol. We're looking at your triglycerides. We're looking at your good and your bad cholesterol. And what's important about cholesterol is, this is a whole subject that we could get onto, but what's important about cholesterol is it not only lets us know, what your actual cholesterol levels are and if there's a concern there, but it also lets us know how your body is processing blood sugar, if we're moving towards a metabolic syndrome, if we're looking possibly moving towards a blood sugar handling issue. It gives us a whole lot of information, again, in the big scope of all of these tests. It helps us paint that picture of what's going on with you. And then also we run a thyroid panel. Now here's a key factor. If you go to your traditional doctor and you say, hey, my thyroid's bothering me, they're going to run a thyroid panel, and they're probably going to run a TSH, and that's it, which measures your thyroid stimulating hormone. You'll understand what that means here in a little bit when we get into the actual thyroid metabolism. But they'll run a TSH. They might run, and check your T3, but very rarely will they run a full thyroid panel. A full thyroid panel consists of your TSH. It consists of all the different measurements of your T4, all the different measurements of your T3. It consists of your thyroid peroxidase antibodies, your thyroid binding globulin antibodies. It consists of this overall picture of what's going on with your thyroid function. And this is very, very important, because TSH alone does not tell us why you are not functioning the way you should be functioning. All TSH tells us is how much T4 and T3 your thyroid is putting out. So you really need to run that full thyroid panel. And a lot of patients will come in and they'll say, yeah, my thyroid's fine, and they'll have their lab values that have that TSH on there. And granted, that TSH may be within the broad range of normal for the traditional model, but optimally it's outside of that optimal range, or even if it's inside that optimal range, they still don't feel good, well, all these other factors will tell us, is your T4 being converted to T3? Is it being transported? Is there an issue in the gut? Is there an issue in the liver? What's going on? Why are you still feeling so poorly? And this lab series is what will give us the foundation to know where we need to go next. Next, we're going to talk about specific lab tests that we run that are very specialized lab tests, and help us paint that overall picture along with these lab tests and the questionnaires that we've already. Okay, so it's March, and this is the time of year where everybody's wanting to get active because the weather's getting so much better. You can see all the joggers getting out and starting to get into exercise programs. And a lot of our patients, especially a lot of our people that have opted in for more information about our thyroid program, this is when they really start to notice the effects of how they're feeling, because they can't get out there and do the things they want to, or they're not willing to go out to the beach because they're not comfortable with how their body looks and they're not confident in themselves. So we do this special in March because we want to help you reach your goals and help you get back to a normal life. So what do these visits include? Well, the first thing we're going to do is we're going to do a complete case review. I'm going to have you actually come in and share with me what your story is. I want to know detail to detail what exactly has happened. I actually have most patients write down their stories so that we don't miss any of these details, because a lot of times, the devil's in the details. A lot of times we can find clues to let us know where we need to explore to figure out what's going on with you. So we're going to go an in-depth, deep case review and history with you. We're going to review labs that you've had doctors run for you in the past. You're going to bring those into me, and I'm going to sit down and I'm going to review these for you. I'm going to review your case and figure out what is going on with you. The next thing is we're going to do a goal review. What are your goals? Do you want to lose 30 pounds? Do you want to just get the energy to be able to function through life, to be able to play with your kids when you get home from work? Do you want to get your sex drive back? Do you want to feel like you again? What exactly are your goals? And then we set up realistic expectations to know when those goals will be met and what might have to happen for you to achieve those goals. We're going to do a complete neurological evaluation. We talked about how brain function is so important to the overall ability of the body to heal itself, and we need to determine, is there transneural degeneration? Are you losing neurological function and don't even know it yet? We're going to find that out. We're going to do x-rays if necessary. We're going to study what the structure of your body is doing so that we can know, structurally, is there an issue that's keeping you from healing? If they're medically necessary, we will do these x-rays and we'll figure out what, again, is going on with you. We're going to do a complete neurological evaluation. Metabolic evaluation. In the lab review that we talked about, I've got very specific questionnaires that you're going to fill out. We're going to know how your thyroid's functioning. We're going to know how your adrenal glands are functioning, your kidneys. We're going to know how your liver, your gut, how your body's processing sugar, how your brain function's occurring, what your neurotransmitters are doing. We're going to know all this stuff by the time we're done. Then we're going to sit down and we're going to go through a report of findings. And I'm going to report back to you everything that I found. You're going to learn more about yourself in that appointment, and you're going to understand more about what's going on with you after that appointment than you've ever known before. At that point, we're also going to go over any financial obligations. If you have insurance, you'll know about insurance coverages. If you have any out-of-pocket, you'll know what that'll be at that point. And then we also offer one complimentary session if you're a patient that does qualify for our program and someone that we feel like we could help you. And let me tell you right now, if you qualify for our program, there's nothing out there that's going to help you like this program will help you. If you don't qualify for the program, I'll help direct you in the right direction of where you need to go to get help. But if you qualify for our program, we're going to go ahead and include a complimentary session for you to come in and see what a treatment is like in our office, see what a brain-based treatment is like, see what we do to try to help you heal and help you get better. So this is a total of 3 visits. The first visit is where we're sitting down and talking and reviewing everything. I'm going to take all that information and I'm going to sit down and write up your report of findings and write up your plan for what we're going to do for you. On the second visit, we're going to sit down, we're going to talk about that report of findings. I'm going to explain to you exactly what's going on, show you what your plan is, and then the third visit, you're going to come in and you're going to get the complimentary treatment to see what you want to do. Now, the total value of these visits is between $450 and $500. That's for 3 visits in our office, quite possibly about 2 hours of my time dedicated to your case to figure out what is going on with you and what we can do about it. And again, it's a cost of between $450 to $500. A lot of times we'll offer special offers for this where you can come in and do this for discounted rates. But for March, we're trying to encourage as many people as possible to get back to normal life. So we're going to do this for $27. And that's all 3 of these visits for only $27. The catch is you've got to be in here and get this done before March 28th. That's a Thursday. You got to be here before March 28th. If you come in March 29th or if you schedule your appointment March 29th, it's going to be the full fee. Okay? So give us a call, take advantage of this. Phone number is 850-862-2224. You cannot lose. You're going to learn more about yourself. You're going to have 3 incredible visits into our office. It's going to be well worth your $27. I highly encourage you to do it. Okay? 862-2224.